Okay, so I am changing my topic for my oral histories. Before I was doing cardiovascular disease, now I've decided that I'm going to do asthma and the effects it has on its sufferers as well as family members of sufferers. I guess not just family members, but also, just how asthma affects people's lives. I plan on talking to coaches that have athletes with asthma as well as athletes with asthma, possibly, or prior athletes who have had asthma, adults who suffer with asthma as children or asthma as children, and also parents of children who have asthma. I want to show, I hope to express how asthma is becoming a bigger problem now today with problems with pollution, and more kids are being diagnosed with asthma and more medications are coming out to handle it. And it seemed like at the time, maybe a couple years ago, maybe 4, it's been a while, but asthma became the big thing for people to be diagnosed with. I think a lot of people's asthma is caused by allergens and, like I said, the pollution in the world, and it's a big thing that people need to worry about. Basically, it's really important to know because there's so many people who have asthma now, and people don't realize the severity of it sometimes. I myself have asthma, so that's how I got interested in the topic, and I figured that it would be good to inform people on asthma, what happens, maybe some of the triggers, and what some people go through when they're having an attack. Also, people, like I said, are more prone to get asthma now, and it's probably good to hear what kind of symptoms you'd have if you had asthma, like tightness of your chest, hard to breathe, things like that. I plan on talking to people who have children who are very young with asthma, which is harder to handle because, babies and young kids can't take their medicine, of course, on their own, and there's special things that you have to do for that. And then also adults who have to handle asthma on their own, and coaches who have had athletes who have asthma to show, I'm hoping that the coaches will say how many more kids have asthma than they did before. Anyway, so that's the plan. I plan on just getting in touch with the people via phone, and then of course talking to them in person. I'll probably do it mostly at the gym because a lot of the people who I work with have children with asthma or have coached children with asthma. My mom has had asthma as a child, plus both me and my brother have asthma, so I'll talk to her, and I'll probably talk to maybe my aunts. A couple of them have asthma and also have kids with asthma.